nerve examination, your annual. Yeah, okay, so I will have you sit down in the seat in front of me. I am the only one in today, and I'm more than qualified to do your cranial nerve exam today. Why don't I first start you off with this little pamphlet that has what we'll be doing today. It has roughly a couple pages in it, as you can see. But I think you've been in for a cranial nerve exam before, correct? Yes, so we'll be doing something very similar. It does look like you've been in a couple times, so you're more than familiar with the process, but I will give you this to kind of go through as we go through the exam. Yeah, before we start here, I'd like to ask for some consent to touch you today. Although this is a medical procedure, I'd just like to ask for consent. I will be touching your face and getting extremely close up to you, if that's okay. Yep, and if I am going to be touching your face, I will be having gloves on, so I hope that is okay still. Okay, good, and as always, if you feel uncomfortable, please let me know. Although I'll be having gloves on, I just would like to sanitize really quick. Just to ensure that's a sterile environment. Alright, so as you read through the pamphlet, we will be testing mostly just your 5 senses here today. Just your scent, your taste, your sight, your hearing, and your touch, of course. And mostly the cranial nerves work around those 5 senses. So why don't I start by getting on some gloves? And we'll go from there, okay? And if you ever feel uncomfortable, please let me know, okay? Yeah. Just trying to make you as comfortable as process through this. Okay, is off, we might have had some issues, so that's why I wanted to start off with the touch. And you can still feel this, correct? Okay, good. Good. Okay. Let's go on to your scent, okay? And for this, I'll have you close your eyes, but you can kind of see what I'm doing here. So I have this wooden skewer, and I also have this cotton ball, which we will replace the cotton ball each time, but so I have this big, fluffy, little, more or less bigger Q-tip, but I'm going to be dipping it in the solution, and I'll be waving it across your nose very gently, and you are going to tell me what the scent is, okay? Now I have 3 scents for you here today, and I will show you with a disclosed scents. So these 3 scents I will be using, okay? And I would like you just to tell me what each one is, okay? So let me just prepare. Okay. Alright. Okay. Just give it a couple. Now you can close your eyes here, okay? Just close. Oh, that's strong. So you can close. And I'm just going to wave it over your nose here, and you can take a deep breath in and out. Do you smell it? Yep, it is coconut, and specifically Capabana coconut. I'm going to take this out, give it a little smear test, okay, and put a new one on. Going on to our second scent here. Okay. Oh, that smells good too. So I'll have you close your eyes again so that you can really smell. And I'll have you just sniff. And what do you smell? Yes, correct. It is more like a tropical pineapple smell. It is poolside punch. So, good job. Good job. Alright. And one last scent for you. Doing a little smear test. Okay. Just making sure this stays on. And one more. This is actually a newer scent that we brought in. Okay. Oh, that also smells good, okay. But it's a little bit different of a smell, so I'll have you just take your time with this one. And one more. Do you smell it? Yes, it is more of like a mistletoe, Christmas. It's actually called holiday mistletoe, so good job, you got the scents correct. And that should conclude the smell test here. I'm just gonna pop this off. Okay, going on to more of our sight test. There's a lot of cranial nerves that actually go with your eyes and how they move. So we'll be doing 2 primary sections of tests for that. So we'll be doing obviously the motion, how you physically move your eyes, as well as just a basic color blind test to see if you can see certain colors, okay? So for this we might have to dim some lights, but for right now I would like to just take a little spoon and test each eye to see how we're doing, okay? Awesome. So I'm gonna just cover your right eye here, okay? Yep, and I would like you to just tell me how many fingers I am holding up. 2, good. And what about now? 4, good. And one last one here. 5, good job. Now we're gonna go on to your left eye here, okay? And what about now? 3, good job. And how about now? 1, good job. And how about now? 5, good job. Good job, good job, good job. This is going by a lot easier than I thought it would be with you, okay? So this is where I'm going to probably turn down the lights, okay? But I do have this pin light here. It's just going to show a little bit of a bright light into your eye. So at all times I would never want you to look directly into the tip of the light. So I'd like you just to stare at my nose for this part, okay? But for right now I'd like to just have you follow my finger, okay? Just move your head like that, okay? And just follow my finger, okay? We are testing your horizontal and vertical follow of your eye, and I'm trying to see if there's any shifts in your vision, okay? And what about when we go like this? Just keep following. Good, good, good. And how about sideways? Okay, alright, and if you want, just just look at the tip of my nose, okay? I'm just going to put my finger extremely close and fall back, okay? And I'm just seeing if your eyes are dilated or not. Or not dilated, but focusing and refocusing. Okay, good. So I'm going to turn down the lighting so that my pen light can do its magic, okay? But I just would like you to stare at the tip of my nose and never to look directly into the light, okay? Alright, awesome. So let's just Oh, good. And if you don't mind looking at the center of my palm here. And now look at the pin light. It shouldn't be too bright now. Okay, good. So I'm going to turn the lights back on so you can slowly ease into it. If you'd like to just close your eyes, okay? Okay, good. That was a good test, but I'd like to just now test, let's see, your color test, blindness test now. So I do have these colorful cards here, and I'd like you just to tell me what color they are when they appear, okay? Yep, red, pink. I would say this is like pink, but either way, you see red hue, correct? Okay. And what about now? Okay, purple. Okay. Great, good job. Most of the time we can see this color quite well either, or our difficulties. Yellow, good job. Blue, good job, good job. And we're going to do a rapid fire round now. Good. Seems you can see color very well. Have you ever had any sort of vision problems before? Okay, and do you wear glasses? Okay, alright, and sometimes I like to do this with my patients just to see when objects are getting closer and further away from you. I like to blow bubbles. Now, this can be frightening for some people, even though bubbles can be seen as a little innocent thing, but to help you out through the stress, I do have this stress ball that is actually quite durable. It's an apple, if you can see it. So, if you want, I can give you this to squeeze the stress away, okay? Yep. Okay. And let's... Alright, now, these are gonna come at you, okay? And, I just would like you, or I'd like to see how you react to them, so you can act as natural as possible. You can pop just swabbing and then it going into your mouth. So okay, and you can open your tongue, and I'm just gonna what do you taste? Mint, good job, that was good. And again. Like a fruity, I have it as cherry, but watermelon, same thing. Okay, good. And this one. Okay. Just open your mouth for me, good. That one was correct, like a bubble gum. Good, alright. So I'm just going to wash this out of your mouth now. And just take it out of there. Just take all that out. Thank you, guys. Alright. And last but not least, we have a hearing test, and this one is quite simple. Since I already know that you're corresponding with me, it is a lot easier to tell if you can hear or not. But of course, I like to still hear, so I like to check inside of your ear with this little picker, as well as my pin light. Okay, so I'm just gonna take a good look into there first. Okay, let me find that. Go to this side, okay? Okay, good. Seems your ears are pretty clean. Do you use Q-tips? Okay, good. So try to make sure you're using it on the outside, because sometimes we can jam the earwax further into our ears. But let's do a little bit of a hearing test, okay? Do you hear that? Okay, good. And this. Good, okay. And why don't I test it with these crinkly little bubble gums, okay? And I want you to just tell me what ear you hear it in, okay? Good. And to the other side. Good. Alright. And let's do a couple more things here. I'd like you just to tell me when you hear the liquid, okay? Good. That was a tricky one. It's in the same ear, okay? Good. One more. Good. Alright. So, I like to just wipe your ears clean if you don't mind, okay? With this little scotch. And then we should be pretty good to go here. I hope this was a relaxing experience for you. Just going to clean off everything here. I hope you enjoyed this, because I tried to make it as relaxing as possible. And it looks like you have no apparent issues with something just not going right, okay? Perfect. Why don't I just check you out here? And I'll just write you a little thing to go. But you can review that little packet that I have set for you, or what we all did today. And I kind of followed through with it in an abnormal order, so it might be a little janky in the order we did things today, but let me just close you out here, and we'll get you printed with something to take home, okay? Alright, perfect, but I'd like to thank you for your time here today, and as always, I love you with all of my person, and